It was the worst experience in my life. I just want to cry and scream. But I remember my daughter was next to me and something came to me and I was, okay, so what is the next step? My name is Sandra Morales. I am from Colombia. I came to live to this country 20 years ago with my daughter Lina, and I am a breast cancer survivor since 2010. When I was 38 years old, I had a very uncomfortable sensation in my left breast. My mom was visiting, and she insisted that I should go and see a doctor to have a mammogram and a sonogram done. Unfortunately, there were no mammograms for women under 40 who didn't have family history of breast cancer, who actually didn't have any risk factors. I was a healthy woman. 2 years passed and my mom was back again, and I told her, where I did have that sensation, now I can feel something. And actually, literally, I did have my first mammogram the day of my birthday. I went for the results with my primary care doctor and he said, this is a suspicious mass. I need you to have a biopsy. The doctor asked me to go into his office. I went with my daughter, who was 19 at the time, completely sure that everything was going to be okay. And he told me, without looking at my face, I am very sorry. This is a very advanced cancer. This was my first mammogram and I was already stage 3 cancer. Unfortunately, when you hear the word cancer, you focus only on the bad outcomes. I didn't know anything about breast cancer. I never ever imagined that it could happen to me. I was really upset and ashamed, and I felt that I wasn't smart enough because how come I didn't listen to my body and my instincts like 2 years prior to this moment? So I decided that I was going to share my diagnosis with very few people in my family. I initially told my sister and a very dear aunt. After I told her, she said, I don't understand why this is happening to you. You are such a good person. What did you do that was so wrong that you got cancer? And I know that she didn't mean any bad. I know she loved me, but it was a real concern and a real feeling she had. There are a lot of disadvantages for Latin community. There are a lot of people that are financially vulnerable, having to choose between dedicating time to go to your treatment or actually going to work. I would say that the financial stress was harder for us than the language barrier. I never imagined when I was diagnosed that I was going to be able to overcome this illness and use this bad experience for some good and have like a very positive impact in other women going through the same experience. I was certified as a clinical interpreter, so I am able to stay with the patient from the time of the diagnosis. I am explaining step by step what is the treatment plan, and after the doctor is gone, so all the questions about what is your insurance, how I am going to help them to actually make all the appointments for all the tests that are required to complete the diagnosis. I find many times women telling me, this is my second place I come, and nobody explained what I did have, how this is going to work for me, what challenges I am going to have, how much time I need to take off from work. One way to reducing the disparities in care is looking for a place where they have a patient navigator. I have been working as an advocate for some years now, and what we do is that we visit senators and government representatives to tell our stories and ask them to see how it's possible that they can give more funding. And it's very discouraging to see a woman that is going through such a hard diagnosis, not having everything that is needed to be able to deal with it at the time. How can we make politicians understand that we have real needs and there are not enough resources?